Delhi, a city of vibrant culture and history, is facing a grave threat. This city, known for its bustling markets, historical monuments, and rich heritage, is now grappling with an invisible enemy that is slowly choking the life out of it. It's a threat that's invisible to the naked eye but suffocates its inhabitants. The streets are filled with people donning masks, a stark reminder of the air's toxicity. The once lively and colourful streets now seem muted under the weight of this menace. This threat is air pollution, and it has reached crisis levels. Factories and vehicles spew out pollutants relentlessly, contributing to a thick haze that blankets the city. The skyline, once clear and picturesque, is now obscured by a persistent layer of smog. Imagine a city where the air itself is a hazard. Every breath taken is a risk, a gamble with one's health. The air quality has deteriorated to such an extent that stepping outside feels like walking into a gas chamber. This is the reality for the millions who call Delhi home. Families, children, the elderly, all are forced to navigate their daily lives amidst this toxic atmosphere. The simple act of going for a walk or playing outside has become a health hazard. Data paints a grim picture. Air quality indices consistently show dangerous levels of pollutants, far exceeding the safe limits set by health organizations. The numbers are not just statistics. They represent the daily struggle of Delhi's residents. Delhi's air quality regularly ranks among the worst in the world. News reports and global rankings highlight the severity of the situation, bringing international attention to this crisis. Yet the problem persists, growing more severe with each passing year. The air is thick with harmful pollutants, exceeding safe limits by alarming margins. Industrial emissions, vehicular exhaust, and other pollutants combine to create a toxic cocktail that hangs heavy in the air. The city's residents are left to bear the brunt of this environmental catastrophe. Breathing this toxic air is akin to smoking dozens of cigarettes a day, even for non-smokers. The health implications are severe, with respiratory issues, cardiovascular diseases, and other ailments becoming increasingly common. The air itself has become a silent killer. The consequences are dire, affecting the health, environment, and social fabric of this megacity. Hospitals are overwhelmed with patients suffering from pollution-related illnesses. The environment is deteriorating and the social fabric is fraying as people struggle to cope with the constant threat to their health. The situation is particularly alarming during the winter months. As temperatures drop, the smog becomes denser, trapping pollutants close to the ground. Children playing in parks are exposed to dangerous levels of pollution, their young lungs bearing the brunt of this toxic air. A combination of factors, including industrial emissions, vehicular exhaust, and agricultural burning, creates a deadly cocktail of pollutants. Nearby agricultural practices, such as stubble burning, contribute significantly to the pollution levels, adding to the already critical situation. The city becomes engulfed in a thick blanket of smog, reducing visibility and making it difficult to breathe. Vehicles navigate through the haze with headlights on, a surreal and unsettling sight that has become all too common. This is not just an environmental issue, it's a public health emergency. The impact on human health is profound, with increasing cases of asthma, bronchitis, and other respiratory conditions. The city's healthcare system is under immense pressure, struggling to keep up with the rising number of patients. The air pollution crisis in Delhi is a call to action, demanding immediate and sustained efforts to protect the health and well-being of its residents. But understanding the sources of Delhi's pollution is crucial to tackling the problem. The air quality in Delhi has been a growing concern for years, affecting millions of residents and visitors alike. To effectively address this issue, we must first identify and understand the various sources contributing to the city's hazardous air. Multiple culprits contribute to the city's hazardous air. These sources range from everyday activities to large-scale industrial operations, each playing a significant role in the overall pollution levels. One major contributor is vehicular emissions. With the rapid urbanization and population growth, the number of vehicles on Delhi's roads has skyrocketed. Delhi has millions of vehicles, and their exhaust fumes release harmful pollutants into the air. These emissions include nitrogen oxides, carbon monoxide, and particulate matter, all of which are detrimental to air quality and public health. Industrial activity is another significant source. The city is home to numerous factories and industrial plants that operate around the clock. Factories and industries release a plethora of toxic gases and particulate matter, further degrading air quality. These emissions often contain sulfur dioxide, volatile organic compounds, and heavy metals, which can have long-term health impacts. The construction boom in the city adds to the problem, with dust from construction sites constantly polluting the air. Construction activities generate large amounts of dust and debris, which can easily become airborne and contribute to the overall pollution levels. These sources, while essential for economic growth, come at a heavy price for the environment and public health. The balance between development and environmental sustainability is a delicate one, and finding solutions to mitigate pollution is crucial. The problem is exacerbated by geographical factors. Delhi's unique topography plays a significant role in trapping pollutants within the city. Delhi is located in a bowl-shaped region surrounded by hills that trap pollutants. This natural barrier prevents the dispersion of pollutants, causing them to accumulate and intensify over time. Additionally, meteorological conditions such as low wind speeds and temperature inversions worsen the situation. During temperature inversions, a layer of warm air traps pollutants close to the ground, leading to higher concentrations of harmful substances in the air we breathe. These factors combine to create a toxic trap where pollutants linger and concentrate, posing a severe threat to human health. The persistent smog and poor visibility are constant reminders of the urgent need for effective pollution control measures. Addressing these challenges requires a comprehensive approach involving policy changes, technological advancements, and public awareness to create a cleaner, healthier Delhi for future generations. The most immediate and devastating impact of air pollution is on human health. Breathing in polluted air is like inhaling a cocktail of toxins, and the consequences are dire. The fine particulate matter, invisible to the naked eye, penetrates deep into our lungs, causing respiratory problems. The rise in respiratory illnesses is alarming. Hospitals witness a surge in patients suffering from asthma, bronchitis, and other respiratory ailments, particularly during periods of high pollution. Children and the elderly are particularly vulnerable, their respiratory systems still developing or weakened by age. But the damage goes beyond the lungs. Air pollution has been linked to an increased risk of heart disease, stroke, and even cancer. The fine particulate matter enters the bloodstream, causing inflammation and damage to blood vessels. This increases the risk of blood clots, heart attacks, and other cardiovascular problems. Beyond the haze, pollution's grip on the environment is tightening. The impact of Delhi's air pollution extends far beyond human health. The environment itself is under attack, with dire consequences for the delicate balance of nature. One of the most visible impacts is on vegetation. Plants and trees, which are essential for absorbing carbon dioxide and releasing oxygen, struggle to survive in such polluted conditions. The haze that hangs over Delhi reduces the amount of sunlight reaching plants, hindering their growth. Pollutants also damage plant tissues, making them more susceptible to diseases. This degradation of green cover further exacerbates the pollution problem, creating a vicious cycle. Water bodies also bear the brunt of air pollution. Pollutants carried by wind and rain contaminate rivers and lakes, harming aquatic life. The toxic water is unfit for consumption, posing a significant threat to human health. This pollution of natural resources has far-reaching consequences for the entire ecosystem. A city divided. The social impacts of Delhi's air crisis are profound. The air pollution crisis in Delhi is not just an environmental or health issue, it's a social crisis as well. The air pollution crisis in Delhi is not just an environmental or health issue, it's a social crisis as well. The thick blanket of smog that envelops the city is a daily reminder of the invisible divide that separates its residents. It's creating a city divided, where the quality of life is increasingly determined by one's ability to escape the toxic air. The wealthy can afford air purifiers, send their children to schools with air filtration systems, and even escape to cleaner environments during peak pollution periods. The wealthy can afford air purifiers, which have become a staple in many affluent households. These devices, once considered a luxury, are now a necessity for those who can afford them. They send their children to schools with advanced air filtration systems, ensuring that their education continues uninterrupted by the hazardous air quality outside. These schools are equipped with state-of-the-art technology to keep the indoor air clean and safe. During peak pollution periods, many affluent families choose to escape the city altogether, seeking refuge in cleaner, greener environments. This temporary exodus highlights the stark contrast between those who can afford to leave and those who cannot. However, the vast majority of Delhi's population, particularly the poor and marginalized, are left to bear the brunt of the crisis. They live, work, and commute in highly polluted areas, with no means to escape the toxic air that surrounds them. They live, work, and commute in highly polluted areas, often in close proximity to industrial zones where the air quality is at its worst. Public transportation, which is a lifeline for many, becomes a daily ordeal as commuters are forced to navigate through the smog. With limited access to healthcare, the poor and marginalized are disproportionately affected by pollution-related illnesses. Overcrowded hospitals and clinics struggle to provide adequate care, further exacerbating the health crisis. This disparity in exposure and access to resources is exacerbating social inequalities. The gap between the rich and the poor is widening as the wealthy can buy their way out of the crisis while the less fortunate are left to suffer. The crisis is also impacting the city's economy. Businesses suffer as customers stay indoors to avoid the smog, leading to empty marketplaces and closed shops. The economic toll of the air pollution crisis is felt across all sectors. School closures during periods of high pollution disrupt education. Children are forced to stay home, missing out on valuable learning opportunities and social interactions. The long-term impact on their education and development is a growing concern. Outdoor activities and sporting events are often cancelled, affecting the tourism industry. The vibrant cultural and recreational life of the city is stifled by the ever-present smog, deterring tourists and residents alike. The healthcare system is burdened with a growing number of pollution-related illnesses, putting a strain on resources. Hospitals are overwhelmed with patients suffering from respiratory issues, heart problems, and other health conditions exacerbated by the poor air quality. Overworked medical staff struggle to keep up with the demand, and the crowded hospital waiting rooms are a testament to the severity of the crisis. The air pollution crisis in Delhi is not just a challenge for the environment or public health, it is a profound social issue that demands urgent attention and action.